Brighter Futures is the programme for the whole of Birmingham to transform outcomes for all of our children. And it's great to have our annual Brighter Futures conference here at the ICC and to welcome Elliott here from the United States to talk to us. Brighter Futures is based on 4 key building blocks. It's built on an analysis of data about what's happening in children's lives, about a design of services which starts off with the outcomes we're trying to achieve, looks for evidence-based practice, redefines the kind of investment that we're making and continues to measure progress. And in particular, one of those design principles is about what's called evidence-based practice and fidelity. How do you get the workforce to deliver that programme really, really well? The 4th building block is that we want programmes that improve outcomes for all our children and our children in need. Elliott's visit to the annual conference is really significant because is focused on implementing successful programmes. So it's combining the message to all of our workforce, to everybody attending the conference, that evidence-based programmes are really important. That's where the proof lies, that certain things that we can do get better results for children. But also the importance of implementing those programmes absolutely the best way we can. If we can get the workforce to deliver these programmes for our children right from the very earliest age up until the time when they're in transition to adulthood, we can make a significant difference for the whole of the city.
What's happening in Birmingham is unique. I've been spending my whole life looking at violence, drug, and delinquency prevention programs, antisocial behavior programs, studying which programs work and which programs don't so that we can focus our efforts and put our investments of our resources into effective programs. So what's happening here in Birmingham is unique, to my knowledge, in the world. We certainly don't have something like this going yet in the U.S. But the implementation of 4 evidence-based model programs accompanied with an evaluation of the fidelity and the quality of their implementation, plus a randomized controlled trial to document the effectiveness of these programs is unique. So it's my privilege to be here and talk about our experience doing that. We've had some experience implementing programs. The programs that are being implemented here are 3 of those programs are programs that we have certified as model programs, so we're obviously interested in seeing those programs promoted, which is happening here. So I think the research community is going to be watching what's happening here in Birmingham to see how well they're able to implement these programs, the fidelity that they can achieve, and looking at the outcomes that they get from their randomized controlled trials. So it's an exciting thing to be here.